I'm Dr. Suvarchala, Scientific Director with Ziva Fertility Centers. When visiting gynecologist or reproductive endocrinologist, a history of your infertility is a very important matter. Your sexual history, duration of trying for a pregnancy, your medical history, previous surgical history, a lot of things are gathered from your history and your partner's history as well. A very important aspect of history taking is also menstrual history. We are going to talk about that and throw some light on what the doctor is trying to gather from this information. Well, menstrual history basically tells us how your endometrium is shedding. Could we assume that your eggs are ovulating? Could we assume that everything is good in the endometrium and the size of the functioning of the uterus as well? So yes, definitely it gives us a lot of information. Of course, it has to be coupled with ultrasonography and hormonal evaluations. So menstrual history can throw light on a lot of things happening inside the ovaries and the endometrium. So what is it that we face when we are taking the menstrual history? There are a few factors that we are confronted with, and that's when the treatment can also be started upon, can be designed. So when there are no periods present, also called as amenorrhea, we can assume that there is no ovulation happening. That is, if you are in the fertile period of your life, you're trying for pregnancy, but you do not have your periods at all from the past 6 months to 1 year, amenorrhea, and it can be an indication that you are not ovulating at all, and therefore assessments and treatment will be given accordingly. If you are having periods after more than 35 days, it is termed as oligoamenorrhea, and it is also a very serious issue, and it gives us an idea that your ovulation is happening infrequently or it is taking a very long time and you do not know when the eggs are releasing. Therefore, to try for pregnancy and to plan for sexual activity or intercourse during ovulation is not going to be very easy for such patients. Then, if your periods are happening less than 21 days duration, polyamenorrhea, as in periods are occurring very often and it's happening very frequently. So, this is also not good. There could be some issues inside as well. And if you're having heavy bleeding for more than 7 days, it is called as menorrhagia. So that's also not good. It could also give us a lot of indications about what's happening in the uterus. If it is very scanty and you bleed for very little time, it could be 1 day, 2 days, and period is very scanty, it is called as hypoamenorrhea. So it means that bleeding is not enough. The shedding of endometrium is not enough. Maybe you're anemic, maybe there's some issue in the endometrium which needs to be looked at. Like I said before, ultrasonography and hormonal evaluations are very critical in coming to a conclusion about the issue. For example, if periods are happening for after more than 30 days or 2 months also, it could be a case of polycystic ovarian syndrome where the cysts are growing up, the eggs are growing up, but none are releasing. So ovulation is not happening. And that correlated with your hormones, that correlated with the ultrasonography can be conclusive of PCOS, and your doctor can then begin to treat you. Then there is the problem of premature ovarian failure where you might not be ovulating, or you may be ovulating very rarely, or you may not be bleeding properly, which I said could be a case in case of amenorrhea or in case of hypoamenorrhea. In such cases, it could be premature ovarian failure which could be causing all this. And so the treatment options will also differ if you're trying for fertility. There could be thyroid disorders. If you are having hypothyroidism, definitely periods are going to be scattered farther apart and doctors are going to be treating you differently for such an issue, even if it is hypo or hyperthyroidism. You could also be suffering from genital tuberculosis, which is a common problem in India, and these problems can also lead to menstrual disturbances, and treatment options then will concentrate on these issues and then take you up for fertility treatment protocols. So these are things that are indicated from your menstrual history. Your doctor then tries to correlate all this, ascertain with the ultrasonography or hormonal tests or laparoscopy even, and only then come to a conclusion about the problem at hand and therefore decide what treatment will work best for you. If you want to understand more, if you have any of the factors that I have talked about and you want to first sort that and then go for fertility treatment, please feel free to contact us. Thank you. A lot of effort has gone into making this video. Please like and subscribe us. Thank you.